Hey everyone, welcome back to Ajax Podcast, where we bravely go where no one really wants to go, right into the restroom.
That's right. Today, we're blowing the lid off infection prevention, or actually leaving the lid open, which turns out to be a terrible idea.
Yeah, because flushing a toilet doesn't just make things disappear. It can launch, a fine germy mist into the air that settles everywhere. You don't want it.
It's basically the glitter of the infection prevention world. Once it's there, good luck getting rid of it.
Oh, what a thought. What a thought. Yeah, today's paper looks at how to actually fight that invisible plume. And spoiler alert, the answer involves a spray can, some serious testing, and a little bit of old-fashioned microbial fear.
And to walk us through this paper, the impact of an air sanitizer spray on risk of virus transmission by aerosols generated by toilet flushing, we're thrilled to have Dr. Charles Gerba joining us.
Yeah, Dr. Charles Gerba, professor at the University of Arizona in Environmental Science, Biosystems Engineering, and Community and Environmental Health. He earned his PhD in microbiology at the University of Miami, was on faculty at Baylor College of Medicine, and has over 700 publications on environmental microbiology and risk assessment.
He's a fellow of the American Association for the Advancement of Science and the American Academy of Microbiology, and even won the 2020 Water Heroes Award for his work on SARS-CoV-2. Basically, if it's tiny, gross, and moves around the environment, he's your guy.
That's pretty funny. Oh, Dr. Gerba, welcome to the show.
Oh, thank you.
So let's start with the big question. Why is flushing a toilet such an effective way to spread germs everywhere?
Well, just looking at it would give you a good idea, but it's a type of toilet we use, particularly in the United States, a siphonic type of toilet, which really creates a vacuum and a whoosh that you hear that does it. And that creates a great number of droplets and that are ejected and settle out to surfaces throughout the restroom. And then you also
Yummy.
Which can persist for a couple of hours in the restroom and do that. This is unlike a European toilet. If you've ever been to Europe, it kind of flows down the sides. We're more like, bang, like that. And that creates a great aerosol when you do it. So it's really the flushing mechanisms. Really, if you want to see this, there's a great video probably online by the University of Colorado faculty that show the droplets being ejected in a time-lapse photograph. Really up to your breathing height. It's a rather dramatic event. And that's to ensure that all the waste are evacuated during a flush. So in a way, it's our modern hygiene approach to getting rid of all the material in the toilet.
So don't take your coffee into the bathroom with you.
Right. Do not put your coffee into it. And that's for personal advice. Keep your toothbrush as far away from the toilet as you can. Otherwise, you're going to brush your teeth with what's in the toilet, from what we found out in our studies.
That's horrifying. So for those of us who want to sleep at night, what exactly is in that aerosol cloud?
Well, if there's, most people don't realize viruses are excreted both in your urine and feces. I mean, even like pox viruses are excreted in the urine, for example, or encephalitis viruses, a wide range of viruses. But if you have an ill person, even an asymptomatic person, can excrete a wide range of viruses, including norovirus, hepatitis, SARS viruses. Some respiratory viruses are excreted in the urine particularly. And of course, you always get the typical Salmonella, Shigella that cause enteric infections. All of these can be present. And they can be present in very large numbers. You're talking millions to billions being present in the toilet when you flush it, particularly if you have an ill person.
Yeah, and your study tested an air sanitizer spray to reduce that cross-contamination. So can you just explain how effective it was?
Yeah, this is a rather new innovation, air sanitizer sprays by the Environmental Protection Agency. So the idea was to see what would be the benefit of this of reducing contamination in the restroom from the toilet flushing. So what we did is we took a bacterial virus, which doesn't infect human beings, and we flushed it down the toilet. And then we tested the air and the surfaces with an air sanitizer and without. And we actually saw a dramatic reduction in the amount of viruses, not only in the air, but also on the surfaces in the restroom, because these will settle out on the surfaces.
It's really interesting.
Dramatic.
And also, you compared spraying for 8 seconds versus 30 seconds. And what kind of difference did you see between those times?
Oh, it made a big difference when we wanted to see, well, what happens if we just sprayed for 8 seconds and then if we did for 30 seconds. And we did get a big impact actually in reduction of the viruses, like 90% more on surfaces and in the air by spraying for 8 seconds. But going 30 seconds made a big difference, though, on contamination of the surfaces in the restrooms. And that we could reduce the number of viruses ejected from the toilet by 99% or more, 99.99% by going for 30 seconds. So the time you spray makes a difference in the restroom.
Now, all I can think of is like an airport bathroom where it's just like flush. And it's just constant flushing and like what you're walking into at this point.
Well, and when you think about it, you put your purse or your bag or something on the counter on the floor and you wash your hands, but you don't sanitize your bags and stuff.
Right.
So you think about all that stuff. It's really easy to see how this stuff travels the world, right?
It's really easy to see that. I mean, if you go to a major airport like O'Hare, I don't think the toilet seats ever get cold. It's something
right.
Yeah. A cold toilet seat's a good thing, right?
Yeah. If you're an Eskimo, maybe. But
or a germaphobe.
Yeah, germaphobe too.
Yeah.
But actually, the floors and the toilet seats get pretty heavily contaminated in public restrooms. You never want to put your purse on the floor. We actually tested the bottom of purses of people, and they do get heavily contaminated. You can find E. coli on the bottom of most purses because people tend to set them down on the floor. So if you can hang it, that's for sure. But
I want our listeners to know the reason I'm laughing is because you all can't see us, but I can see Jess's face throughout this entire talk, and it's pretty funny.
Well, most of my career has been in the toilet, and I have you have to realize too, I've had the police call on me in public toilets while I was taking samples before.
Have you seriously?
Oh, yes.
Oh my gosh.
Not many people take samples of toilet seats and floors, apparently.
Somebody called the cops on you when you were doing it?
Oh, yes. Well, I think that was an instance. We were timing people to get an idea how long they were in the toilet.
Hey, I'm calling the cops, too.
Well, people actually prefer certain toilets, by the way, to give you a word of advice since you brought up public restrooms, is looking at contamination. If you have 3 toilets in a row, the middle one is more contaminated. And interviewing people prefer the middle toilet. I guess you feel more secure. I don't really know. So always go to the first toilet.
I heard that somewhere, but not because of this reason. Keep going. Yeah, I want to hear about it.
Yeah, and there's more chance of having enough toilet paper too.
Good point.
So
our preference.
Where did you do that? Were these public restrooms you were in, or?
Yes, public restrooms. Yeah, we were studying.
Wow.
We did a number of studies on public restrooms in the healthcare too, like waiting rooms and that.
Okay.
Wanted to see, well, if somebody was ill in a waiting room, would the virus tracers move out of the waiting rooms? And they did, and particularly in emergency rooms and waiting rooms, they moved to the nurse's station. So what's in a restroom does not stay in the restroom, is what we found out in a lot of them.
This is not Vegas.
That's correct.
So were these, when you say they were public restrooms, were they hospital public restrooms or malls or? Okay.
Hospital public restrooms were people like waiting rooms where they're waiting to see a relative, for example, or emergency rooms. They tend to get contaminated also to a greater degree. Public restrooms are hard to control. Probably public restrooms have somewhat more of a risk because more people use it and the more probability of coming in there with it aging. And one study showed that about 70% of public restrooms have adenoviruses, which cause respiratory infections on surfaces. And mainly because people have chronic infections with adenoviruses, for example. So you do find a virus is being excreted, can be transmitted by public toilets. There's a number of them that have been, even SARS, the first SARS COVID. Remember the apartment building where the ventilation system was believed to be involved from aerosols from toilet flushing, and some evidence for SARS being transmitted by toilets in hospitals too.
Interesting.
There's a paper on that. So there's always a possibility for it. And that's one of the reasons we investigated the spray disinfectants to give an alternative. The idea there was to use a restroom and then spray the restroom, and you would reduce the contamination of the restroom after use and that.
Well, let's get a little technical. So you did some pretty glamorous lab work for this. Can you tell us how you actually simulated norovirus contamination in the study? I know you used what's it called, MS2 bacteriophage to stand in. So why was that the right choice?
That's a good question. MS2 bacteriophage is very similar in size and genetic composition as the norovirus, and it's been used a lot as a model for testing disinfectants for the norovirus, because norovirus are very difficult to grow in the laboratory, not easy to work with, and they present an infectious risk if we use those to the people doing the work. So that's why MS2 was chosen, and we could grow it in the high enough numbers to simulate the levels that you might find in the toilet with a person infected with norovirus.
So I have a lot of questions floating around in my head right now. A lot.
Well, let's flush them out.
Right. Good one. But I think the big question that is probably floating around everyone's head at this point is, should we actually be concerned about catching infections from bathroom air, particularly in these public restrooms that we're talking about?
Yeah, I think the risk of inhalation is low, but the risk of is higher with like norovirus, which will settle out on the surfaces. You'll touch the surface and then bring your fingers to the face. There have been outbreaks of sorts. It's with cruise ships. Norovirus is the curse of cruise ship lines. With schools, hospitals, emergency rooms where they've been traced to the restrooms. The evidence is that they're in the restroom, that it seems to be the focal point. So I think particularly when there's an outbreak occurring or there's an issue we've seen with cleaning, how well public restrooms are cleaned after outbreaks and that. So I think this gives you another barrier in reducing the probability of transmitting of norovirus or other enteric viruses by the toilet flushing.
So tell me, can I walk into a bathroom and just spray regular surface disinfectant into the air?
No, regular surface disinfectant. We did try that in our studies, and it didn't work for reducing the amount of viruses, largely because it wasn't effective in the air. We used a product, an air sanitizer that was very effective in a design, particularly and registered for the EPA, by the EPA, I should say, to inactivate the viruses in the air. But you have to realize hard surface disinfectants, which is a common one that we use, is designed to kill the viruses on a hard surface, not in the air. So we used a product that was specially designed to kill the viruses in the air, and it didn't work quite well. But a regular hard surface disinfectant did not have that same impact.
So interesting.
Can you explain why? Like, what is it about that? How does that work? How does air sanitization work?
Air sanitizer sprays are designed, they're a different type of a product that's designed to inactivate the viruses by combining with their outer capsid, as we call it, and using the air, where hard surface disinfectants are really not designed to be in the air at all. And so I think that makes a big difference in them. What the design and that it's really a specialty product. Mostly it's an air sanitizer, and it does have a fragrance to it too. So it does have that benefit. But you know what it's been used because there's a fragrance associated with it.
Any, as I'm thinking about spraying something into the air, any risk for people being in the space when this air sanitizer is in use at all?
Well, it should be used when you're exiting a restroom. In other words, spray it in the restroom and leave at least for 30 seconds is a recommendation to give it time to settle out. That way you reduce the risk of inhaling, You want to always, in any kind of product, you want to minimize the risk of inhalation. So it's really designed to be sprayed and then leave the room.
That was going to be one of my questions. So this is going to be, it wouldn't be super feasible to apply this to a multi-stall public restroom, really, unless you can dedicate certain times to get people out or after an incredibly rough bathroom usage.
In a large public restroom, it would probably be best that after they usually close the restroom, and after the custodial crew works in there, to spray it after they leave the room would be my recommendation. I think it's best designed for individual, patient rooms or home rooms, and particularly when somebody is ill, like with norovirus or diarrhea, or might be unusually susceptible to it. So, I mean, it's be good to use after that, reduce your exposure to it. So, I think it has limited use. It has other potential uses we've been considering too for the future, like after you have a conference in a conference room, spray it in the conference room. Actually, one of the germ-laden places we've ever found in healthcare is the break rooms, for nurses' break rooms and physician break rooms, because they're not disinfected. They don't get the same deep cleaning as they do. So we thought, well, this would be a good product after a conference or use of a break room. You could use the spray because then everybody exits.
Does this have any applicability to, so I'm trying to think of how we could use this in patient rooms. We've got patients in there with Shigella, norovirus, C. diff. Is this applicable to patients with those viruses, number one? And number two, has there been any study on the efficacy against C. diff?
No.
What are you laughing at, Jess?
You said number one and number two. And I was like, no pun intended.
I didn't even notice I said that.
This particular product isn't designed to work against C. diff. So
I didn't figure.
But it still may reduce the amount in the air by settling the droplet when the droplets settle. So it's always a possibility. But there are, you brought up other potential uses for it too. Particularly after cleaning, after a patient room, it'd be a good idea to spray it, because we know when you vacuum clean something, you just push all the viruses and bacteria on the floor into the air. So after you vacuum cleaning, it would be a good idea to use it, or cleaning a facility, because you stir up everything. Just moving a drape aerosolizes like MRSA, for example. It's been So I think any cleaning activity creates aerosols, and this would minimize anything being in the air, particularly after the use of a patient room, would be a good idea, or any kind of a cleaning activity. You'd be amazed. I mean, how much we've done studies on vacuum cleaners, how much is thrown into the air during a vacuum cleaning.
That's super interesting. It sounds like the paper showed that there was a more than 99% reduction in risk of norovirus transmission from surfaces. And we talked a little bit about how this could potentially be useful for other types of organisms as well. But how would you maybe see this being used by infection prevention teams in real world settings?
I think it's my idea that we showed with what we did as a risk modeling, which has been validated against epidemiological data to show that by using this product, you reduce your risk by 99% or more from acquiring a norovirus infection. So I think really the uses that we see for it is having maybe a can of this in a patient room, or utilizing it after the room is cleaned and a new patient has arrived, putting it in the air to reduce the risk. I think it would have a good use in emergency room restrooms between uses too, because there you have ill people in there. Those are three of the areas in the healthcare we see potentially. And I think too, in conference rooms, when people leave, you can transmit measles from air in a room after it's been vacated. So I think it gives you an additional barrier in the healthcare area. The thing I like about it, it's simple and easy to use. It's not like scrubbing every surface every time to inactivate the organisms in that. So, and it seemed to be pretty effective. It was able to eliminate a lot of the viruses on the surfaces too. So that we kind of have hope for that we could hopefully eventually from our standpoint in the future is try to show that it has potential other applications and to document it that it's actually a benefit. I think that's one of the things that we were trying to do here. We saw a definite benefit to its application.
And, no study is perfect. So what do you see as the biggest limitations here, or what questions still need to be answered?
That's a good point too, because we didn't consider like ventilation makes a difference. So maybe if you sprayed and turned the ventilation on, only a few seconds are needed then, because you both have the action of the air being moved out of the room and the ability of the air sanitizer to kill the virus in the room. So we weren't able to really do that. Also, the design of the toilet flush. What about the lid being down? In previous studies we've done, the lid being down doesn't help a lot because the airflow is so fast out the sides of it. Also, anything in the toilet gets on your kneecaps if you're standing next to it, by the way, goes right out onto your pants.
I mean, I'll be honest. I am that person who I try to wait to flush the toilet until I can be ready to scoot right out of the stall. Like, I don't even like to be in there.
Yeah, I'm a kind of a flush and run kind of person.
Yeah.
Our study is the survival of the norovirus and may be different in the air on surfaces. It's likely could be longer or shorter. That's one limitation of the study. And the volume of water during the flush is different in different types of toilets in hospitals and healthcare and home. So that could be another limitation of the study. So in the design of the restroom too, the size of the restroom could make a difference too. Those are all limitations, like with any study too. But hopefully in the future, we'll be able to address some of those things and maybe better optimize the spray time that could be used to get the maximum benefit.
It's so cool. It's such a really interesting concept. And I mean, I know we joked and we laughed a lot, but it really is a very, very interesting topic. And we're very appreciative, Dr. Gerba, of you joining us today and for making our listeners rethink every public restroom visit they've ever had.
Yep. Yeah, I agree. This is a lot of fun to talk about, but yeah, it is pretty serious. Sorry, I cut you off, Dr. Gerba.
As something about public restrooms is that in 50% of people will wipe a public restroom toilet seat or put toilet paper on top of it or a seat. So in some ways, public toilet seats are fairly clean, but the flush handles and the latches to get in out of the toilet and the sink basins are the most contaminated.
So anyone who uses their foot to flush is justified. That's my big takeaway.
Except for the next person, because the floor is loaded with E. coli in public restrooms. So if you use your foot,
then everybody has to use their foot. Sorry, that's our big takeaway here.
And Nikki, I think the big takeaway is once again, hand hygiene is one of our best methods for prevention.
Very, very, very true.
But also, It also makes me think that porta potties may not be as bad as I thought because they don't flush.
Yeah. Our studies of porta potties, they are cleaner than most public restrooms.
Whoa.
That is mind-blowing.
Okay, we're doing a bathroom reno at home. I'm just going to get a porta potty. That's it.
Get a composting toilet.
Yeah. Oh, wow. Okay, don't tell my husband that because that's his next going to be his next project. Oh man, this really was it was a blast. Bunch. And I really appreciate you coming on, Dr. Gerba.
Oh, sure, anytime.
Okay. All right. To our listeners, may your flushes be cautious and your aerosols few. We'll see you next time on AGIC Science into Practice. Guys, that's a wrap. Thank you for joining us today. We are Nikki Shore and Jesse Swain, and this is the American Journal of Infection Control podcast, Science into Practice. Thanks for listening and doing your part to prevent infection, because remember, infection prevention is everybody's business.
AGIC Science into Practice is created by the Association for Professionals in Infection Control and Epidemiology with input from the APIC Center of Research, Practice, and Innovation, and Jean Brandt at AGIC and APIC staff, Rebecca Bartles, Ria Gupta, and Bobby Gulshan. We work in partnership with Human Factor and audio techs Blake Alton and Carolyn Schneer. To hear other AGIC episodes and to access information about this podcast and the field of infection prevention and control, go to our website, agicscienceintopractice.org. That's AJIC scienceintopractice.org.